Alright guys, it's jerninhgam here. Daily numbers for coronavirus death. Numbers in labs are 445. 110 I think deaths in the UK, coronavirus. Could change, could go up. Other places in the UK are probably gone higher. So I thought I'd just mention it on this video. Which is a good thing. I don't know what else to really say in the video. I've done another video about the deaths today. Very saddening for a lot of people that more things are rising all the time. It doesn't seem to be getting any better. So 44,422 total deaths. Coronavirus. Talk about 5G here, move Hawaii. Measures of growth and pose imminent threats to the UK national security. Just trying to think what's going on here. 900,000. They're talking about 900,000 pay rise for doctors, teachers, police, because they've been standing for the pandemic to helping people. So they're talking about pay rises, where they're getting their pay rise. I'm thinking about all these homeless people are getting no money, so some people are annoyed about it. They're talking about thousands of vacancies for nurses, and some nurses have lost their jobs in 2010. But they're talking about pay rises. I'm just talking very quickly to try and keep up the news. And about virus crisis. They're talking about second peak of virus. I'll put a bit on just
in the staff,
so you can hear it.
It's a 10% pay rise, and that's what we're calling for in Nurses United.
For people, I think, who might be confused by nurses not getting a pay rise, I think I'm right in saying, Anthony, that nurses negotiated a separate pay deal, a 3-year-long pay deal in 2018.
Teachers will get
come up for renegotiation.
3% pay rise. Doctors will get 2% pay rise. But nurses will say
inflation has gone up by 31% since 2010. Nurses' pay on average has gone up by 11%, so we've lost 20% of our pay, and that's why we've got so many vacancies within the NHS, and it's putting pressure on our services, and it's putting patients at risk. That's why we need to increase pay.
Yeah. What would be, to your mind, an adequate pay increase that would compensate you for what have been described as the years of austerity?
We've argued for a 10%
this is live
pay rise
leads
because it might actually show that the government cares about nurses and public sector workers, and as you've gone and rightly pointed out, it shouldn't just be extended to NHS staff, it should go throughout the whole of social care, because it's also them who are putting pressure on services.
Got announced 900,000 public sector workers such as doctors, teachers or nurses above inflated and pay rise.
And so that's why we're arguing for a 10% pay rise, because we need to put measures in
Hong
place
Kong,
that are going to keep the public
Iran,
safe
Middle East,
and also help our
peaceful
economy.
Protest.
A lot of social care workers,
Health Secretary Matt Hancock's tells sound and
they wouldn't be included in
community that is
anyway.
the target.
But what the government could do is it could increase the funding that they provide for this,
COVID-19 testing a day.
Nationalise social care, which is what they've basically done during
Adding
coronavirus.
that trying
They've
to
gone and
explain
renationalised
the
all the
UK's
private
testing.
healthcare services and gone and relied upon the social care sector. It makes sense for us to have a national health and social care service, because this shows, if anything, during COVID, that it affects all of us. We're all interconnected.
China's behaviour over COVID-19 has been disgraceful, adding that we want to
Anthony, what would you say to those people, and you do get people who say this, who will argue that
understanding
public sector
China's
employees
threats following
do
talks
vital
with
work,
Prime
and that's
Minister
rewarded, it's
Boris
recognised,
Johnson.
not always in pay, but in other ways. If you're a teacher, you get lots of time off. If you're a nurse, you know, have other elements of what's going on in your working life, whether that's a pension that's very favourable compared to a private sector pension. And job security at a time like this, when hundreds of thousands of people, potentially millions of people, stand to lose their livelihoods, if you're a public sector employee, you're not likely to be sacked.
But at the moment, what we're going and seeing is that we're likely to reduce the amount of The thing is if
Intelligence
we're
Security
going to
Public
people
reports
at risk, if we're
allegations
having
of
nurses
Russia
who are dying,
intelligence
if we've got nurses who are going to food banks,
in the UK is
it's going to
saying
mean
Russia
that we're not
cyber
going to have any nurses
abilities
working. So surely we
measures
can all
are
agree that we
given
want to be able to keep the service safe
processing
during the
immediately threats
coronavirus pandemic.
to the
If we're
nation
going to have a second
security.
beat, that means that we need to invest in it. And so that's the thing that we need to decide upon, is what do we actually need to rely on and what do we need to invest in? At the moment, if we're going and struggling to be able to recruit and retain NHS staff, that means that we need to decide to invest in it.
You say COVID is responsible, tragically for nursing staff losing their life, and that's one of the reasons why there is a shortage of nursing staff. I mean, people looking at the figures will say, well, you've got a National Health Service which employs in excess of 1 million people. And I think I'm right in saying the number of NHS workers who have tragically lost their lives whilst dealing with COVID in England stands at around about 300, which is awful, clearly, for those involved, but it's not the kind of order of magnitude that is seriously going to diminish the service provided by nurses.
But
Phones
we're
on
world leaders
19%
in the
of
death rate
battery.
of health and social care professionals. If you look at Amnesty International's data, there's been 540 health and social care staff who have unfortunately died. And that's down to a lack of PPE, and it's down to not putting protections in place to keep NHS staff safe. But beyond that, we need to... The thing with this is, if we're going to have health and social care staff put at risk, that is obviously going to then make people decide to leave. We know that people are always stressed in the NHS, and we're already under more pressure than we usually are. If people are going to decide to quit and leave the NHS, that's going to mean that the NHS is not safely staffed. 140,000 NHS nurses, which is basically half of them, are 45 years or older, which means that they're 10 years away from retiring. And that's a massive issue for our workforce that's coming up. And we're only going to accelerate it if we don't do anything to go address the conditions which nurses are working within.
Anthony Johnson, appreciate your time. Thanks a lot.
Cheers for that. Thank you.
Dangerous misinformation about coronavirus has been allowed to spread virulently across social media. This is according to MPs on the Digital Culture, Media and Sports Select Committee. They blame a lack of legislation to prevent the content. The committee calls for an online harms regulator to be appointed with powers to hold social media platforms to account.
US
Johnson reports.
Secretary of State
As coronavirus spread across the country, so did lies and conspiracy theories about its cause and possible treatments. Misinformation shared widely on social media and messenger services included the false claim that rasam soup, which is made from herbs, can cure COVID-19, a hoax that cocaine kills coronavirus, and the false theory linking the 5G network to the spread of the virus. That led to arson attacks on phone masts. This one in Birmingham was set on fire in April.
Is this 5G?
And telecommunication workers were targeted.
That's how the coronavirus is spreading. Wuhan, China, they put up 10,000 of these, and then people started getting sick.
The first Dave Snowden heard about the conspiracy theory was when two men knocked on the door of his van.
I wound the window down. The media there says, are you working on the 5G network? No. You want anything to do with 5G mass? I said, no. And then he said, you best not be, because there'll be trouble, in a strong language. Kicked the door of the van and then knocked the mirror out the side door. Got in the car and sped off, and I thought, what was all that about?
Even though they're false, theories can spread rapidly. Where does misinformation come from?
State-backed media agencies in Russia and China, and their goal is just to present misinformation about how their governments are dealing with the crisis.
Some false claims have been repeated by world leaders.
I see the disinfectant that knocks it out in 1 minute. And is there a way we can do something like that by injection inside?
Donald Trump later said he was being sarcastic. MPs have found misinformation can cause serious harm.
We've heard from healthcare workers on the front line who have reported quite a serious instance of people who've ingested bleach and other chemicals.
The government says it will introduce legislation and is working closely with social media platforms to help remove incorrect claims that could endanger people's health. Becky Johnson, Sky News.
People living today, people alive today, could see polar bears wiped out in the wild. This is the warning from scientists to say they could become extinct by the end of this century as global warming robs them of their natural hunting.
My phone's on 17% of battery, so I'm going to have to charge it at some point.
For long distances in search for food. Sky's Ivor Bennett reports.
They are one of the polar bears' most powerful predators, lose the ice caps, but also among its most vulnerable. Despite their size and strength, polar bears have no defence when it comes to climate change, with scientists now warning that melting sea ice could see most wiped out by the end of the century.
The problem is now they're having less time to feed and a longer time to wait till the ice returns. Typically the ice melts in the early summer, midsummer, and then returns in the fall, and that period when the ice is absent.
Keep checking my phone to see how long it's on for. That's why you can see my hand here a lot of times. I want to know how long the things that says 70%
Polar bears
battery.
rely on sea ice to reach their prey. Without it, they're forced onto land where there's not enough food to sustain them, and such impressive beasts are rendered helpless. By modelling how much energy they use, researchers at the University of Toronto worked out a polar bear's survival limits and when those would be reached in different parts of the Arctic. Their bleak conclusion being that in some areas, that limit has already been surpassed.
Ultimately, if we really want to save polar bears, we need to revisit what people concluded at the end of the Paris Agreement, or the Paris Conference in 2015, which was that we should be shooting to hold world temperature rise below 2 degrees Celsius.
The scientists say aggressive cuts to greenhouse gas emissions are needed to save this species from extinction, with what they call a high emission scenario resulting in the likely collapse of all but a few polar bear populations. It's estimated there are 26,000 currently living in one of the coldest climates Earth can offer, but if that disappears, there's simply nowhere left for them to go. Ivor Bennett, Sky News.
This is Sky News today. Coming up, 2 girls with a rare neurological condition are walking some 200 miles of charity. We're speaking to one of the parents about that journey.
Well, guys and girls, hope you all enjoyed the video. Give it a like, give it a comment, and share it with your friends. And I'm sure I'll be back to do some more filming when my phone's charged. Obviously, it's on low battery and it's getting even lower. So, thank you for joining me. See you in the next video. Peace.